Welcome to the Boomer Buzz, the show that focuses on issues of interest to the 60 and over crowd, both here on Long Island and across the country. Listen as experts keep you informed about the latest health solutions, financial options, and lifestyle choices, both for senior citizens and their families. Now, here are the hosts of the Boomer Buzz, Dr. Lamar Stanford and Patricia Stanford, Corporate Wellness Consultant, on the voice of Nassau Community College, 90.3 WHPC.
Welcome to the Boomer Buzz, where each week we give you the buzz on how to stay healthy, wealthy, and wise after the age of 60.
Today our topic is self-reliant health for boomers, and our expert guest is Dr. David Duffy, MD. Dr. Duffy is a Harvard Medical School graduate and has practiced medicine for over 45 years. His area of specialization is internal medicine. He is also the author of the informative ebook called Self-Reliant Medicine, which is available on Amazon. Dr. Duffy has shared with us that he's over the age of 60 and he's retired, so he's an excellent spokesperson for healthy living for boomers.
Welcome to the show, Dr. Duffy. What exactly is self-reliant medicine? What does that mean?
As a physician, you were taught to make a diagnosis and prescribe treatment. So if a person had a heart attack, they would get a medicine to prevent, take aspirin to prevent a new attack. If they were weak, they would get a water pill. They got medicine for suppressing cholesterol. And so you were given medicine, and basically, the patient was not told how to help themselves get better, but what to take so they can keep going. After being 17 years at a city hospital, I went into my own practice late in my practice, and I developed what I call self-reliant medicine, which emphasized patient education and try to get the patient to participate in the healing process.
Keep going.
Now, let's say a person has high blood pressure, and you're told, well, take it easy, avoid stress, and take this pill. Okay, now, medicine doesn't really tell why you have high blood pressure. It's kind of a nebulous diagnosis. And if the person individually says, okay, let me see my life. Okay, I hate my mother-in-law. I stay up late doing the internet, and I'm angry at my boss. Maybe if and I eat too much salt and I'm 50 pounds overweight. Okay, what are you going to do about all those things? All of those things are unhealthy. Let's do an experiment. Okay, let's improve your attitude, get some more sleep, get rid of the excess carbs, start to lose weight, and let's see what your blood pressure does. And patients that I worked on in my office did those things. And we showed that we could reduce the blood pressure, reduce the medication, and they got down to a better weight, and their blood pressure got better because they participated and discovered for themselves what made them better.
Now, I noticed in your book that you had this quote, "The body has the capacity to heal itself." You're trying to involve the patient more in their own remedy, aren't they?
Correct. The patients have been sold a bill of goods. Come to the doctor and I will treat you. I will make you better. So they get a pill, which they're dependent on for the rest of their life, and they can function, but they don't get better. And the problem is that we, in modern medicine, relieve symptoms, but don't heal. And you have a large group of patients that feel better and stay sick.
Now, what you're expecting a patient to do is really get involved and maybe a little bit of self-discipline. We're not used to that, are we?
No, we are not used to that. The insurance companies pays for you to get better, and all you do is take your pill and go to the doctor once a month, and you should be fine.
Now, another quote that you had in the book was, diet is the key to healing. Now, that kind of goes along with self-discipline. Watch what you're eating, does it not?
Absolutely. Okay, the idea of healing involves taking away what makes you sick and putting in what your body needs. So, if we are interested in changing our diet, there is a principle that we use called dietary dialysis. In the 1800s, there was a German man named Arnold Ehret who went to medical school. He very much wanted to be a doctor, but while he was studying, he got sick with kidney disease. And he went to the German doctors, and they said, oh, you're losing protein in your urine. You need to eat more protein. And the more protein he ate, the more sick he got. So he gave up on that, went to Italy and North Africa, and basically fasted and had a diet with predominantly fruits, and got better. And he explained that by describing what he called the mucusless healing system. But actually, he was using the same principle as we use in renal dialysis today. You are going to, when you have kidney dialysis 3 times a week, you are going into the clinic, and through the vein, your body is having rinse. You're rinsing your blood for a couple hours. That's cleaning it out. Well, guess what? If you eat a lot of fruits and vegetables and have the natural water in your diet, and you cut down on heavy foods, you are rinsing your body through your diet, and that's how you lose weight and improve your metabolism.
So Dr. Ehret had to get sick himself before he kind of discovered this.
Correct.
How much pain does a person have to take before they actually start changing their diet and their exercise and stuff like that?
Now, that's a good question. If you take all the patients, not everybody is interested in getting better. They like their coffee and donuts. They do not want to go to bed early. And so it's a sliding scale of compliance. You explain the idea. People appreciate knowing about themselves more. Even if they don't do anything to improve themselves, they become better patients and take the medicine they're supposed to because now they understand. But if they're very motivated and they're looking for this kind of thing, then you give them a transition diet. You say, well, you don't want to give them an impossible task. You don't want to you're not imposing upon them a regimen like boot camp for the Marines. You are inviting them to make some choices in their life, cut down on the heavy food, eat more fruits and vegetables, and start doing changes that are possible, and see what happens.
You're listening to the Boomer Buzz on the voice of Nassau Community College, 90.3 WHPC. I'm Dr. Lamar Stanford, along with my wife, Patricia Stanford, who's a corporate wellness consultant. And our guest today is Dr. David Duffy, MD, talking about his book, Self-Reliant Medicine.
Dr. Duffy, I noticed you mentioned the term biological clutter, and you mentioned the term transitional diet. Now, in the wellness field, so many people talk about detoxing. Is it similar to what people are referring to as detoxing?
There's a overlap in that concept. Typically, a person who is addicted to a drug has to detox. And if you are addicted to junk food and you stop eating the junk food, you're going to go through withdrawal effects. So that's, and some people think of detox as kind of having colonic enemas and taking herbal laxatives and stuff. I don't subscribe to that. When a transition diet is taking away foods that you deem unhealthy and substituting foods that would help your body. And that's very individual.
Okay, so what would you say would be a positive transitional diet that somebody who is sick can go on to get better?
Okay, if a person has the flu and has a cold or viral syndrome, you rest. You may go on just a liquid diet for a few days and kind of cleanse yourself that way. But we didn't mention biological clutter yet. Okay, when a person has a, quote, all-American diet for 10, 15, 20 years, by the time they hit 40, they're 20, 30 pounds overweight, they have a touch of arthritis, their blood pressure is high. Now, why is that? Modern medicine says, well, they have a disease. And to name it explains it. No. For instance, a person with diabetes who has high blood sugar chronically is going to have deposits of that sugar in their eyes, in their blood vessels, in their kidneys, in their heart. And this accumulation of junk or clutter is what causes the body to age and deteriorate. You go along until it hurts. Okay, a person has a tendency to diabetes for 20 years, but they don't get a diagnosis until they have a blood sugar of 300 and end up in the hospital after a birthday party. But they've been sick for 20 years. And if you're in primary care, self-reliant medicine, you're going to start teaching them how to eat properly for their individual metabolism from the very beginning and hopefully prevent this disease process from occurring.
That's fascinating. So what you're saying is that a lot of these things are many years in the making. You just don't wake up one day with some of the problems that we associate with aging, and it's not just because of aging, it's because of this thing that you're calling the biological clutter.
Yeah, it's like, okay, a newlywed buys a new house and they start their family and they have a 2-car garage, an attic, 4 bedrooms, and whatever. Okay. Now, after the 3 children are grown and are teenagers, what does that house look like? The attic is stuffed. The garage is filled. They have to park on the street because they've accumulated things throughout the house that are unusable or impair the proper function of the house. This is what we're talking about with our body, because our body is the house of our spirit, if you will.
Oh, that's wonderful. I love that. This is a great time to take a break. I'm Patricia Stanford, along with my husband, Dr. Lamar Stanford, and our guest today is Dr. David Duffy, Harvard-trained medical doctor, talking about his book, Self-Reliant Medicine. You're listening to the Boomer Buzz on the voice of Nassau Community College, 90.3 WHPC.
If your skin could talk, would you listen?
As your skin, I forgive you. I forgive you for poking and popping me when I broke out at 14. I forgive you for that awful belly ring hole you left in me when you were 15. I forgive you for damaging me before prom, on spring break, and at tanning salons when you were 16, 17, 18. But I'm your skin, and if you continue to tan, I hope you can forgive me. Forgive me when wrinkles begin to show and I start developing age spots. Forgive me if I develop melanoma when you're only 22. So please, I'm asking you to stop. Stop tanning now. Our future depends on it.
Protect your skin from melanoma, the second most common cancer in young women 15 to 29 years old. And protect your future. Learn more at spotskincancer.org. A message from the American Academy of Dermatology.
Welcome back to the Boomer Buzz on the voice of NASA Community College, 90.3 WHPC. I'm Dr. Lamar Stanford and my wife Patricia Stanford. And our guest today is Dr. David Duffy, a Harvard-trained medical doctor talking about self-reliant medicine. Now, Dr. Duffy, you mentioned in your book that when you give your body what it needs, it responds by attempting to heal itself. What do you mean by what your body needs? How do you determine what your body needs? It seems pretty individual, or is it a generic thing?
Okay, ultimately, everybody is unique. And in the scriptures, we were told these foods are clean and these foods are unclean. I use that concept. Okay, now you have a, quote, healthy person who is basically energetic and has a full lifestyle, but they get colds every winter, they get allergies in the spring, they have back pain, and so what's going on? You're going to ask them, what do you think your body wants? What is your body telling me? If you're having allergies and pouring out mucus, where's that mucus coming from? Sure, it's the pollen that's stimulating it, but there's mucus inside of you already triggered to come out. Now, if you eat a lot of junk food, candy bars, cookies, white rice, white bread, that sugar and starch can make mucus. If you cut down on it, so you really want to be a researcher, and if you've had allergies every spring for the last 4 years, and then you say, well, I'm eating, bagels in the morning and cheese, that stuff. Let's change that and see what happens. People can tell from their experience once upon a time I had a patient who got involved in a group that recommended having a vegan diet. And she had asthma, skin eczema, and allergic rhinitis. When she changed her diet and had gone for 6 months, she had no more mucus, no more asthma, and no more itching. She was much better. However, after 6 or 8 months, it was her birthday, and a friend sent her a gift basket with cheese and crackers. And she ate that and broke out with all her symptoms all over again. Now that is evidence that this is what was triggering her symptoms, and she had learned from that, but she was not always compliant, and she would still eat the crackers and the cheese because she loved cheese, and still had to suffer because she wouldn't completely stop doing what her body didn't want.
It's kind of like we were talking about before. How much pain does a person have to submit themselves to before they change, right?
Right. The best way to heal is to help a person understand, if you do this, this will happen. And a person heeds that, and they do well. A person hears that and says, well, I don't care. I like this. So they do it and they get sick. In other words, at what level do they listen and obey? That's the trick. And everybody's different. There are wonderful, intelligent people who are killing themselves because they like foods that are poisonous to their body.
So it gets back to that fact we're talking about.
Absolutely.
Food is the medicine for the body, really.
Hippocrates, way back, 400 BC, made a study of patients who were sick and either survived or died. And his concept was food is your remedy. When a person is sick, you make the diet simple. You shift from lasagna to soup. You shift from bread to salad. Hippocrates said that you're only going to get healed through what he called the healing crisis. You have to have symptoms to get rid of the thing in order to heal. Modern medicine says, oh, you're sick. And they give you medicine to suppress the very symptoms that you need to get better.
That was my follow-up question. Where do pharmaceuticals play a role in this process, or do they? Can food solve it all, ultimately?
Okay. Food does not solve it all. It's an element in the equation. Attitude, understanding, economics. If a person doesn't have enough money to get fruits and vegetables and they're living on cheap junk food, they're going to get sick. This is why you can't impose what works for you on another person. They have to be able to judge for themselves, because their compliance, their obedience is not to an outside force, not a mean old doctor, but it has to be within themselves to do what's right for their body because they believe in it and they obey themselves.
You're listening to the Boomer Buzz on the voice of Nassau Community College, 90.3 WHPC, and our guest today is Dr. David Duffy, a Harvard-trained medical doctor, talking about Self-Reliant Medicine, and you can buy his book on Amazon.
Well, we're excited to learn all of this, and I wanted to ask you something about one of the phrases that you just used. You said that people needed to change their attitude. Can a physician or somebody in my field who works in wellness, can we help that process in helping people to understand these things and maybe be more aware of what they need to do?
Yes. My feeling is that this requires patient-based research. If a person has a disease and they change their lifestyle, it's just diet is only a part of it. If they do everything that they can imagine to help themselves get better and it shows the result, then we have to gather that information and share it with other people so that they become a role model for good health. We don't have enough role models for good health.
Can I just ask you a question, Dr. Duffy? What role does exercise play in this, particularly for us retirees who are over 65? Is that crucial? We're told that that's crucial.
My feeling is that the best exercise is to have activities in your life where you move around. To sit as a couch potato for 8 hours and then go to the gym and run around in circles and lift weights for 30 minutes for your exercise of the day doesn't make any sense to me. It needs to be balanced. We're in a situation where everything is pre-canned. you're supposed to do this, and you tap that schedule, and you're going from one place to another and doing this and this and this. And they have healthy activities and essential activities and necessary activities, and all that is a bunch of gobbledygook. Because what is ultimately right for you cannot be imposed upon you. In dealing with patients who were in the medical profession and nurses and nurse practitioners, they were living horrible lives of hurting themselves, not getting enough sleep, eating junk food, living off coffee, and they needed to change for their own benefit.
Okay, this is such wonderful information. I'm sure that the people who are listening to our show will want to know more. So, Dr. Duffy, how do they get in touch with you if they want to know more?
I have a website. It's davidlduffybooks.com. And on that website, you can order any of my books directly through Amazon into Kindle. And I also have a way of your asking questions and communicating with me and gathering information on patient experiences if you're interested in that.
Oh, that's wonderful.
Dr. Duffy, it doesn't sound like you're trying to build a practice. You're retired. You are an honest broker as I look at you. You are not in the pharmaceuticals back pocket. You're an honest broker, and I appreciate your candid responses today, and I hope the boomer population is listening to you. Dr. Duffy, what is one of the most important thoughts that you could leave with this group as we finish up our program here? What's the most important thought you'd leave with the audience?
The most important thought is how your body is so precious, even if it's imperfect, and to really care for it and take care of yourself and be in charge of your health yourself is what we need to do to really help us be healthy.
We want to thank our guest, Dr. David Duffy, the author of Self-Reliant Medicine, for joining us today. His ebook is available on Amazon. Dr. Duffy, I hope you can join us for another session as we barely scratch the surface of this fascinating material.
Thank you. I definitely would like to do that. It's been a pleasure to talk with you.
I'm Dr. Lamar Stanford, along with my wife, Patricia Stanford. This show is available as a podcast on iTunes, Android Podcast, Spotify, and Spreaker.com. If you have any comments, email them to us anytime at WHPC.